Welcome to Connecting Citizens to Science, a podcast from the Liverpool School of Tropical Medicine about engaging communities in global health research. I'm Kim Ozano.
And I'm Bea Egged, and throughout this series we'll be talking to researchers from around the world, exploring how they connect with people to address a range of challenges in global health.
Hello listeners, welcome to the Connecting Citizens to Science podcast. This month's brand new series is all about promoting social change with communities and people living and working within urban informal spaces. The ARISE research team, which stands for Accountability and Responsiveness in Informal Settlements for Equity, works with residents of informal settlements who are partners in research, often termed co-researchers. Together, they are working to co-develop solutions to health and well-being challenges. The multi-country ARISE research approach, which we will explore more throughout the months, has found that telling stories and using visual methods are really useful ways to bridge the power-laden distances between the lived realities of people, the research that's being done, and the policy that needs to change. These methods aim to help researchers and communities to find joint ways of making sense of different power and how we can challenge that power so that people and scientists can work together. I will be here with my brand new co-host, Robinson Karuga. So Robinson, how are you today? And tell us a bit about yourself.
Oh, hi Kim. Hi everyone. I'm really delighted to join in this podcast. I'm a research scientist by training, and my main area of focus is health systems research, and I do more community health research, and my specific focus is around governance and quality improvement in research. So I also do a lot of research around community-based, but especially research methods, where we seek to understand how to improve health and well-being amongst citizens who live in informal settlements in low and middle-income countries. So glad to be here, and that's over to you, Kim.
Welcome. So we are also here with two guests, Inviolata and Shrutika, who will be helping us to understand how they've used creative methods to connect with people in urban marginalised communities. So Inviolata, can you start by introducing yourself, who you are, and some of the work you do?
Hello, Kim. Hello, everyone. I'm happy to be here. My name is Inviolata Njoroge. I work for a local non-governmental, non-profit making organization in Kenya called LVCT Health. Currently, I work as a research officer for the ARISE study. Before joining ARISE study, I worked in a PEPFAR-funded adolescent girls and young women program called DREAMS. And DREAMS stands for Determined, Resilient, Empowered, AIDS-free, Mentored, and Safe. The program aimed at reducing HIV acquisition among vulnerable girls and young women living in informal settlements. So in ARISE, I'm pretty much home. And also in poor rural areas with high incidence of HIV. In this program, I coordinated the implementation of structural interventions which indirectly act on vulnerabilities that increase the risk of HIV transmission.
Thanks very much. It sounds like you've got lots of experience working with people in informal settlements and also different population groups, which will be really interesting for our listeners. Shrutika, same question to you. Tell us a bit about yourself and the work you do. And where are you in the world?
Hi, everyone. Thanks for having me here. So I'm based out of New Delhi currently, which is the capital city of India. And I work as a research assistant at the George Institute for Global Health in Delhi. It's an independent medical research institute with its headquarters in Australia, but it has its branches in India, UK, and China as well. So at the George Institute, I'm working on the ARISE hub as well. And as a part of this hub, we work with waste workers, so which includes sanitation workers, door-to-door garbage collectors, and waste pickers in the informal sector, who are more commonly referred to as rag pickers, in 3 states of India. So we have a diverse range of waste workers that we are working with. I've done my bachelor's in economics and my master's in international relations. I'm currently pursuing my PhD in global health from the Liverpool School of Tropical Medicine. and it's located within Arise itself. So I work on Arise and I do my PhD together. It's really nice to be here. Thank you.
Welcome. That sounds really interesting. And I think we want to understand the population groups that you both work with a little bit more before we move on to Robinson. So, Shrutika, maybe you can describe a bit more about waste workers and some of the considerations that you've had to think about when doing research with this extremely marginalized population.
Right. So I think within the rubric of Arise, obviously, it's to work with people who live and work in urban and informal settlements. And I think when we had to begin our work in India, we were confounded with this question in terms of which population groups to work with. And I think at that point of time, we realized that within urban informal settlements, the group of waste workers tend to be the most marginalized and oppressed because of the nature of their occupation. Waste in itself is often seen as a taboo, and everybody tends to distance themselves from it. So all the more for people who actually work with this occupation day in and day out, they experience the sense of othering in various ways every day. So within waste workers, there's also people who are called manual scavengers who go down in drains and sewage and try to work there. But we figured that that is a group of people that is already being represented and researched about in various quarters. But what we found is that sanitation workers and door-to-door garbage collectors, and especially waste pickers in the informal sector, didn't seem to have much headway in terms of the research that was being conducted in India. So at that point of time, I think we decided to go with the three states that I told you about. And one of them happens to be Himachal Pradesh, which is in the northern part of the country. Now, it's actually located in the Himalayas. So the terrain is very different. There are hills, there are steep slopes. So to imagine door-to-door garbage collection there is actually very difficult. And what we found is that in current scholarship and knowledge, there's actually not a lot about the way and the challenges that come forth with door-to-door collection in such areas. So I think those are some of the considerations that we had to make in terms of working with the communities, and also with, I think, our access to grassroots partners as well. So in the southern states that we do work with grassroots partners who've had access to these communities for decades. But it's only Himachal where we are actually directly working with the communities without any kind of interface or grassroots partner as well. So that has its own challenges and strengths.
Yes, I can imagine it introduces another partner into the research process. So that's really interesting. Just for our listeners, are there any social political aspects that would be useful for our listeners to understand from a context point of view?
Yeah, so I think especially in the case of India and waste work, caste is actually very central. So the caste system is the system that's been used to differentiate people based on their ancestors and the kind of caste that they were born into. And waste workers usually come under this legal definition of being a scheduled caste. So they are in the most dominated caste within this caste system. And it's usually people from this caste who perform this kind of stigmatizing work in itself. So caste has a very big role. And I think migrant workers are also people who end up coming into these occupations because they can't actually find a lot of work in their own host states as well. And in terms of gender, so what we've observed is that within waste picking in the informal sector, there are a lot of women who do waste picking, but they're always at the lower rungs of the waste picking process. So they're the ones who are actually involved in collecting and picking waste, the actual act of picking waste. The more remunerative the waste treatment process happens, more and more men seem to occupy those levels. So you don't see a lot of women being scrap dealers. You usually have men occupying those positions of power where the prices of different recyclables are getting decided. So it's very rare to see women occupying those positions.
Thank you. I think that really sets it up very well. And so just quickly, Inviolata, moving over to Kenya now, what are a similar question, what are the things that you've had to consider in your work when trying to work with communities?
Yes, the ARISE study is implemented by multiple partners, and our mandate in this is to document experiences of most vulnerable populations living in the informal settlements, which are elderly persons, persons living with disability, and children heading households. So for these populations, what we realize is that they are very hidden populations. It may sound that they are not stigmatized, however, they are very, very hidden. When we were recruiting our study participants, who are not very many given the type of, we were going to use Photovoice as a data collection method, it was very difficult to find children heading households as study participants. So they are there in the community, but they are not seen. They are completely voiceless. And even when there are programs and interventions that are meant to target children in general and children who are vulnerable, mostly they are left out. We took about 2 weeks to find the children participants. However, we already had recruited persons with disability as well as the elderly persons. So that is one thing we learned, and I think it's when other people are implementing research, it's something that, especially targeting children who are vulnerable, something to consider. The other thing around the recruitment was the use of community health workers or the community resource persons. They were very instrumental in identifying who these are, because most of the time we do have data, population data, but it's not very specific. So it becomes very difficult to just go into a community and try and get them. So the use of community resource persons was helpful in that process.
Thank you very much. Child-headed households is a term maybe that when I had to Robinson, you could explore a little bit more and how the method connected with child-headed households. So I can see we have an extremely stigmatized, dominated population in India, and in Kenya, you're working with these hidden populations. So Robinson, I will hand over to you to explore the methods a little bit more and how they access those communities.
All right. Thank you, Kim. And thank you very much, Shrutika and and Inviolata. I feel like I've learned so much about the marginalized and vulnerable populations that are very much hidden in plain sight. So maybe, Inviolata, before we jump into the methods, could you speak a little bit more about child-headed households?
The children heading households, children who take up the parental responsibilities or responsibilities that the guardians or the parents should be taking up. And most of the time, what we found out that they are rendered into that situation because of either they were abandoned by their parents. A mother just woke up, just left one night and left the children sleeping, and so the elder child takes up the responsibility of taking care of the other siblings. They even have to drop out of school just to take care of them. The other thing is around alcoholism. There are some parents who are completely incapacitated by alcoholism or drugs. They would wake up in a drinking den and even sleep there, so they don't pay rent, they don't try and fend for the children in terms of food or even paying their school fees. So the elder, the senior most child is the one who takes up that responsibility. The other situation is around sickness or ailments that have the parents or the mother or the father bedridden. So when they are bedridden, they are unable to look for work or provide for the children in any way. So in those circumstances are the ones that lead to children heading households. And from what we have observed, my own observation as we've collected the data, children heading households do not benefit from sympathy that orphans would benefit from, given that people would say, or the community looks at them as children who have their parents. So whatever situation is going on there, they don't get so much sympathy as orphans would receive from the community. And so what happens is that they have this very huge burden in their lives, given that they are not only taking care of themselves, but they're also taking care of the parents who are incapacitated or are just irresponsible.
Oh, thanks, Inviolata, and I'm really impressed with the work that you're doing. So let me move on to Shrutika. I'm very interested to know more about the methods that you apply, to connect with the marginalized populations that you had spoken about earlier. So please tell us a little bit more about the methods that you use to connect with these citizens.
I think over the course of the last 3 years, we've really had to learn, relearn, and unlearn practices of the way that we conduct research with the community. And for most of the communities and subgroups of communities of waste workers that we're working with, a large number of them are illiterate. So they cannot read and or write. Um, and so I think even we've encountered challenges in just trying to communicate the basic fundamentals of the research itself. It's not even about going into the details. It's just about trying to even translate, say, the acronym of ARISE into something that the communities will possibly understand. And it's also to, I think, make that message very clear and concise and not overwhelm them with what we're trying to do. Because I think the moment that one says research, people tend to get um, uh, slightly overwhelmed and also defensive about it, because there's been a history of very unethical research practices and researchers just coming in, using them as data entry points and just kind of leaving. So with the communities that struggle to read and or write, I think our focus has been constantly on evolving and adapting audiovisual methods.
Yeah, so Shrutika, you recently published a very powerful blog, and I love the title, very catchy title. It's titled Invisible Lives Behind Visible Waste, Experiences of Sanitation Workers and Waste Pickers in India. So to all our readers, this very powerful blog was published in the BMJ Global Health. That was in June of 2020. So Shrutika, yeah, tell us a little bit more about the methods that you applied, for this research.
So there was this time when we were very new to working with waste picking communities in the informal sector, and we actually didn't know what their work looks like or what was involved. So there's this practice or a method of shadowing under the larger rubric of participant observation. And what that effectively means is that um, you shadow the person of interest. You're effectively their shadow. They continue to work and do the kind of work that they do. And your job in that sense is to just observe and not effectively intervene in the workings of that person. It's another thing if that individual decides to have a conversation with you about something, which ended up happening with me. So in 2019, I was shadowing a waste picker in the informal sector in the southern state of Andhra Pradesh. So through that time, so I actually left at 2:30 in the morning from the waste picker's home, and then shadowed her throughout the city until about 5 or 6 p.m. till she was done. So throughout that period of time, she did not eat a single meal. She did not stop by for a sip of water at all, because it was very important for her to make that earning for the day. They don't earn a salary, so whatever recyclables it is that they collect, um, the sale of that is their earning for the day. And so that process was one thing. Of course, I had reflections from it. I captured a few pictures, videos about how that work was done. But I think and when we had a debrief with the team, we were wondering about how do we actually take this not just back to the communities that we're working with in other action sites, but also to the larger audience in terms of the general public, to make them a little more aware and sensitive about this issue. And that is when we actually thought about the idea of a photo essay. So a photo essay in sense was a mix. It wasn't in a typical mainstream photo essay where you have very small captions. This was weaved more like a story in terms of my conversation with the waste picker while I was shadowing her. So there were all of these pictures and videos, but they were supplemented with text as well. And when that process was done, we went through quite a few rounds of drafting it. So we went back to her, and we actually sat her down. We sat with her. And because the text was prepared in English, we translated everything into the vernacular. And because she couldn't read and or write, so we orally narrated that whole story. And we showed her the way that the pictures and the videos were appearing. And we asked her whether this is an accurate representation. Is this okay? Do you feel like you don't like the way that you're being represented here? So, all of her feedback and everything was incorporated, and then that piece of work was actually published. So I think through that I think the way that pictures and videos can actually speak, words can't really do justice. So we've shown that photo essay to a lot of the other community members that we work with across the action sites, and it is far more relational than I think words ever can. So I think that's the way that we've learned that in any presentation that we do with community members, it's not so much about doing a PowerPoint presentation. That PowerPoint presentation, whenever it has a lot of text on it, people tend to get a bit uncomfortable with it. You can also see that the attention span kind of starts fizzling out because they're just not comfortable with that setting. The moment you just have one picture or you just have one video showing them the kind of work that they do, but in a different setting, it's far more relational for them, and it starts the conversation in a much more comfortable and efficient manner.
Mm-hmm. Oh, that's really powerful. And the title, it can't leave my mind: Invisible Lives Behind Visible Waste. So that's really insightful. So I'll stick a little bit with you just to explore deeper. So, how did this method of shadowing really bring out the voices of this marginalized population? How do you feel it benefited them?
What I've felt is that through the shadowing process, I, as a researcher with many layers of privilege, understood from a distance what it involves or feels like to be a waste picker. I'm just saying that from a distance. I still don't know what it feels like to be a waste picker. So it's very grounding to actually experience that in person. So it's not just, it's very different to, sit down with a waste picker or a waste worker and ask them, okay, so, tell me a little bit about your work. What does it involve? So if she had told me that, I wake up at 2:30 in the morning in this setting, it doesn't give me an idea in terms of the surrounding in which she wakes up. It doesn't give me that context in which she starts working. It completely it just doesn't involve the way that the people speak to her. But I think when I shadowed her, I could observe all of that. I understood that when she wakes up at 2:30 in the morning, it's under a flyover, and it's as informal as a setting that can get, where you're, surrounded by lots of animals. But 2:30 a.m. is usually a time that you would consider is so quiet, and things like that everywhere else in the city. But for their settlement, it's a very, very active space because they have to get out as early as they can in order to get to that recyclable waste. So I think, to your question, Robinson, it provided a sense of groundedness and contextuality. So I don't know whether I really cannot say whether it benefited the waste pickers, but I think what it gave us is a sense of grounding and confidence to document and articulate what they were saying in a much more refined and nuanced manner. So it gave us the confidence that we were not actually articulating things that were just at the top of our heads or imagination. We knew that it is located somewhere, and there was evidence of that. So, yeah.
Thanks, Shrutika, for really sharing the work that you're doing with these marginalized groups. So let's move to the Kenyan context. So Inviolata, tell us a little bit more about the work that you're doing with the marginalized people that you mentioned earlier on. So
For Arise, we use the Photovoice method to collect data on vulnerability from persons with disability, the older persons, as well as the children heading households. We identified just a few of participants from each of those categories. We trained them on photography, and the training included techniques of photography as well as the ethics of taking photos. We then left them free to take photos of aspects they considered important in their lives, but centered around vulnerability and marginalization. We then had an interview centered around the photographs that they took. And during these interviews, they described what the photo was about and what they wanted to communicate through that photograph, and perhaps what they would want to see changed so that they can have a better picture of that situation. We also conducted other interviews with other participants of similar um, demographics. So we had also other children from the community who are heading households, just to collaborate that the information that we got, or just to check if the experiences of that were shared by the Photovoice participants is the same as what these other children heading households, or the older persons, or even persons with disability, if it was the same.
how does this photo voice method help to bring out the stories?
I think Photovoice is a very powerful method of data collection. It brings out aspects that a normal interview wouldn't bring out. They would capture their lives at night, spontaneously, even as situations arise. And that is something that we wouldn't be able to capture in an interview where you're seated with somebody face to face, or you are ticking off a questionnaire. So that to me, that was very powerful. And as they describe the photos during the follow-up interview, then you can see all the emotions, and how that situation that is captured by that photo affects them. And it's much more than what the words would describe. So it's a very rich method. And even the very silent participants who will not speak much. And I will give an example. We had two participants who were very, very silent, very silent. When we have some FGDs, that is focus group discussions with other people, they wouldn't speak a word in that setting. And even when you sit with them one to one, they wouldn't speak much, but their photos speak a lot, because really they are powerful and they have very deep meaning. But in terms of them just speaking out, they are still very voiceless. They lack confidence, but they did a good job with the photos. So that is one aspect that brings out the voices of the voiceless.
Wow. Oh, sounds like a very powerful method. Thanks, Inviolata. So, let me ask you this one last question before I move on to Shrutika. So, if anybody wants to use Photovoice to bring out the voices of the voiceless, so what things should they consider or should they put in place before they even head out into the field for Photovoice?
We do have the advantage of technology nowadays. Simple phones, and there's that can be used to take very good photos. And the good thing about photography, it's easy even to train the persons who are to take the photos, the vulnerable persons, and they get very excited to participate in that exercise. So at least technology, and we also have platforms where we can share the photos easily. We have WhatsApp. There's I mean, yeah, WhatsApp is an easy way, or and even emails, Google Drive, search. So those are good platforms and makes the work easier. Um, the other thing is to prepare the research assistants or the people who are going to work with the study participants, because it's not an easy exercise. Going to even seeing the photos, discussing with them about all those vulnerabilities affects a person. Our own mental health is even challenged. And I will give an example. After I started analyzing some data that had been collected prior before I had joined Arise, I found myself um, packing chapati. Chapati is some sort of bread that is not leavened. So I would pack the chapatis and I'll put in the dustbin so that when they are collected, those children will have food. But because what I had seen when I was analyzing the data is these children didn't have food, they will go and collect food at a dump site. So in my way of thinking, uh, and I wasn't conscious until my husband told me, I think there's a problem here. What you are doing, I don't think it's benefiting who you want to benefit. But so I think they can that participating in Photovoice can have some challenge to the research assistants who are supporting that kind of method of data collection.
Mhm. Oh, thanks, Inviolata. That's really insightful, and I believe our listeners are listening to this, and yeah, there's good lessons about what to consider before going out into the field. So Shrutika, you told us you shadowed the way speakers from 2:30 in the morning, but I mean in the context of shadowing our this invisible or the marginalized communities. So what should somebody put in mind or put in place before shadowing?
Thanks for your question, Robinson. So I think when I've been thinking about this question in terms of what needs to be put in place, I think more than anything, I think there needs to be a sense of reflection and clarity within the research team that decides to implement something as shadowing, as to why do you want to do shadowing, like why do you want to use this method. I think a round of discussion within the research team and just individually as an independent researcher, um, or in whatever capacity, you need to have that sense of discussion with yourself in terms of why you want to use this particular method, because the way that you will conduct that method, or you put that method into use, will largely be dictated by your outlook towards that method and your purpose. The way that I've done shadowing will be very different from the way anybody else in another context would do it. You know, shadowing is not something that is been used only for those who are marginalized and those who have been oppressed. I think it's been used because participant observation as a larger method has been used in very different contexts, even for industrial purposes. So I think one is that sense of clarity and discussion. Second is naturally to take permission from your grassroots partners and the communities that you're going to be working with, and really explaining to them and having that really open conversation with them in terms of what this shadowing involves. We need to be really honest with them that we do take down notes. And a lot of the time, sometimes, somebody you're shadowing, they will tend to feel very like, under the microscope, because you have a person who's shadowing and noticing every move that you make. It can be a very disconcerting and uncomfortable feeling, especially if you think that I'm doing something wrong, or that's against the law, or that's something that's frowned upon. Somebody is making a note of that. So I think um, for the person that is being shadowed, it's very important for both of you to have that sense of trust that, if they actually tell you that please don't make a record of this, don't document this, don't make a note of this, you need to respect that, right? So I think that level of trust and rapport needs to be involved with the person that you're shadowing. And three, obviously, that in case you decide to produce any kind of output from this exercise, whether it's your own reflections, anything that's going actually in a public platform that talks about their life, I think it is our responsibility to actually go back to the person who has participated in this process and let them know that this is the way that I've articulated it. It might be your own blog, it might be about your own feelings and um, expressions and thoughts, but it is still emerging from observing somebody else. And I think without them being in the picture, you probably wouldn't have had this train of thought. So I think that is the kind of level of accountability that you have to the person that you're shadowing. So they have as much of a right to know how their life and their story has been articulated. So I think those are the three things that I would advise.
Mm-hmm. Wow. All right. Oh, thank you, Shrutika, and thank you so much, Inviolata. You're doing commendable work, and I'm really looking forward to reading more about the works that you publish or write up. And I've been following some of the work that you've been doing at the ariseconsortium.org. So looking forward to reading a lot of the stories that are coming out from these marginalized communities. Every good thing has to come to an end. So let me hand you over to Kim.
Thank you so much. I have learned so much, and really good to see the considerations of mental health of researchers and communities. We get so wrapped up in research sometimes that I think we can forget about that. So really good to hear that, and to reflect on your own personal motivation for doing a method. I don't think we've come across that, and I really like that. So thank you both for enriching myself and our listeners. So in 30 seconds, name one piece of advice you would give to researchers and scientists so that they can better connect with communities. Shritika.
Okay, so I think one piece of advice that I would give to anybody that's working with marginalized communities is to really practice sensitivity and reflexivity, and be very conscious of the language and terms that we use while talking to them. I think a lot of the time we really subsume their sense of agency by thinking that either because they're illiterate or because they live in urban informal settlements, they actually don't know what they're talking about. And we're here to tell them. So I think that sense of reflexivity about one's own positionality and privilege really needs to be thought through more as researchers or as anybody else who's working with marginalized communities. And also remember that at the end of the day, they are also human beings with all goodnesses and flaws. So it's also important to not romanticize any particular community or any particular individual, because we're all human beings at the end of the day. So there is no, there's no need to kind of epitomize or make anybody a god or goddess in this process. So, yeah.
Thank you, Shrutika. Inviolata, one piece of advice that you would give to our audience of how you can connect with communities better as a researcher or scientist?
I would say that vulnerable persons are very hidden, so there's need for really intense effort and patience in finding the right study participants if you want to research around very vulnerable populations, because most of the time you get participants who are not very vulnerable, given that they are the ones that can easily be found. Then Photovoice also provides a platform for participants to sort of debrief, and sometimes emotions flare up and wounds bleed again. So there's need for to consider having psychosocial support system even as data is being collected.
Great advice there from both Shrutika and Inviolata from the Arise Consortium. So thank you very much for being wonderful guests, and Robinson for joining me as a co-host. Thank you to our listeners for listening today. Goodbye.
Thank you.
Thank you. Thank you too, and bye.
Thank you.